Delegate Toscano.
Thank you, Mr. Chairman. First, I'd like to make your day by moving to strike, well, asking you to strike 2232.
At the request of the patron, House Bill 2232 be stricken. Do I have a motion? Without objection.
Thank you. I've got, next is 2215. It's entitled Adoption Assistance for Children with Special Needs. You ready, Mr. Chairman?
Yes, sir.
Thank you, Mr. Chairman, and members of the subcommittee. This bill will better facilitate adoptive placements and ensure currency for children with special needs. There are a couple changes in the code that are in this bill. First, it clarifies that children who are eligible for state-funded maintenance are children with special needs who have been in the custody of social services. There's been some problems in the past where people have not been in the custody of social services. There's adoption that has occurred, and then there's been an issue about whether we can provide adoption assistance. This will make it such that only the kids who are coming out of placements with social services and are adopted get access to that adoption assistance. The second thing it does is that it adds the language that was in the 2012 Appropriations Act, and currently I think is item 3046J1, which states that all new adoption assistance agreements have to be negotiated with a representative of the Department of Social Services. This is important so we have some clarity as what the agreements are, and they have to be negotiated with social services. And finally, you might remember last year we put in language in the budget in the Appropriations Act. It was item 356, 3C, and you all remember that, I'm sure. Dr. O'Banner remembers that, Dr. Garrett remembers that very well. That extended adoption assistance to age 21, and this bill will add this language into the code. So with that, the only one here to testify for the bill is Mr. Ayers, and if you have some questions for him, you can ask him, but it's a pretty simple bill. It tries just to clean up the language in the special needs section of adoption.
We have a motion and properly seconded to report the bill. Are there any discussion from the subcommittee? All in favor?
Aye.
Opposed?
Thank you.
Bill's reported.
Okay, so now I have another adoption-related bill. This is HB 2216. Tell me when you're ready, Mr. Chair.
I'm ready.
Thank you, Mr. Chairman, members of the subcommittee. This relates to a nice little term called the Putative Father Registry. Some people call it the Punitive Father Registry. And for that reason, one of the things this bill does is change the name of the registry to the Virginia Birth Fathers Registry. Now, I think this subcommittee or the committee was involved several years ago. I think courts was also involved in this, when the Putative Father Registry was set up. And it was set up partly to protect fathers who might not be aware that a child had been born to someone with whom they had had relations. And it allows prospective fathers to register their name with a registry, and so that when adoptions occur, people check the registry to see if that person's name is on it, so they can be provided notice that their child, that they didn't even know they had, might be adopted. And the feeling was this made it a little fairer to fathers who are out there who might not know about this. There have been some, over the years, there have been some issues with the time periods for the notice, and this bill tries to clarify those time periods. It also makes some changes, I believe, that have to do with federal law, having to do with how this operates. But I think it's pretty fair to say that some people in the adoption community have always been leery of the Putative Father Registry because it does slow down adoptions a little bit. You have to check the registry to make sure that nobody's rights are being curtailed in an adoption. But we think it's better for the fathers who might be out there, who at least are given an opportunity to be heard in the event that adoption of a child might occur. They have to register, and there's certain time periods within which they have to be given notice. Mr. Ayers is here to address questions you might have about the bill, if any.
Are there questions from the subcommittee? Chair, do you have anything to recommend? Never mind. It's been properly moved and seconded to report the bill. Any discussion? Hearing none. All in favor, please say aye. Aye. Opposed?
Do I need to appear at 9? You want me to provide 9?
This won't be on docket until Thursday, but it should be on.
All right, just let me know if there's any issue. Thank you very much.
We won't kill it with you if you're not here. Delegate Murphy.
Morning, Mr. Chairman.
Good morning.
I have an amendment in the nature of a substitute. This is HB 2041.
Mr. Chairman,
Delegate Ora.
could we have her explain the differences, please, before we adopt this, since those of us who read the measures were looking at the original?
In the original, it had it administered by social services, and this change has it administered by the community college system, which was more appropriate.
Mr. Chairman,
Delegate Garrett.
just briefly, I don't know, Delegate Murphy, I mean no harm. The fiscal has 150,000. Does that change the fiscal impact of this?
The amendment changes this because in working with the community colleges, they want this to fund 200 students with a maximum of $4,000 each year. We don't know how many students will actually be taken in, but if you got actually 200 students at $4,000, it would be $800,000. Even with my really bad math skills, that's a lot of money. But as a pilot program, we don't really know how many students this would start with.
Substitute is moved and seconded without objection. Accepted. Questions for the subcommittee?
I'll make a comment. There are a number of ways we use TANF,
Yes, sir, I know.
so I think this is certainly something that'd be worth looking at, but I think if we choose to act positively, the proper motion would be to report and refer to the program.
Is there anyone in the audience to speak to the bill?
Good morning, Chairman Bell, members of the subcommittee. My name is Ellen Davenport. I'm with the community college system, and thank you very much for having the opportunity to speak to you this morning. I'd like to thank Delegate Murphy for introducing this bill. What the substitute does is it increases the amount and the number of students who would be eligible in the first year of the pilot, and there is an $800,000 budget amendment that Delegate Murphy has filed to accompany this. So this would be $4,000 a year, 200 students. The funds would be paid to the BCCS for disbursement to two community colleges in the first year, which is what the legislation allows. We currently, in 2016, had 1,296 students who were TANF eligible. That's both dependent students, single adults who were eligible for TANF, and parents of other students, of other children. And the unmet need was $12,499,977. Many of these students are also eligible for Pell Grants, but Pell doesn't cover everything, especially in the summer. Pell doesn't cover the summer semester at all, so we envision that a good use of these funds, if you so choose to go down that path, would semester. And I have other information if you'd like to hear it, but we strongly support the bill. We have worked with the Department of Social Services on the amendments. Thank you.
Thank you. Yes, ma'am.
Good morning, Chairman, Committee. I'm Kim Bobo, Director of the Virginia Interfaith Center for Public Policy. We support this bill as a means of helping people get out of poverty and get on their feet. Thank you very much.
Thank you.
Good morning, Mr. Chair, members of the subcommittee. Jill Hankin from the Virginia Poverty Law Center. We also support the bill. This is a very concrete way to help families get out of poverty. They need support to get the education they need to gain certificates or professional credentials. Thank you.
Thank you. Subcommittee members, the bill is before you.
Chairman.
Laura.
Question of the patron, Delegate Murphy, on line 11, this pilot would begin this year. From a practical standpoint, is that even possible, given that this wouldn't go into legal effect until July 1?
It would still be calendar year 2017. Yes, it would still be calendar year 2017, but it would be, you're right, July 1st, 2017.
Laura.
Does community college system agree that it can happen this year?
Yes, so we're already working on implementation strategies. The Senate Finance Committee has asked for this. We've got to share some views as well.
Move to recommend reporting and referring.
It has been moved and properly seconded to report and refer the bill to appropriations. Any further discussion? Hearing none. All in favor, please say aye. Aye. Opposed?
Thank you, Mr. Chairman.
Delegate King.
Good morning, Mr. Chairman, members of the subcommittee. I have House Bill 2119, and you might recall about a year ago when we were upstairs in a smaller room, we had a long conversation about this issue, and I'm back because, as you might also recall, the subcommittee saw the wisdom of studying this issue for another year, and so you continued this until this year. This deals with regulation or lack of regulation of laser process for the specific purpose of hair removal. And back in 2015, when I brought this bill, the reason I'm still bringing this bill is I had a constituent, a young teenage person, who went to what on the surface looked like a legitimate business, a clinic, and the mother took him to get some hair removal, and as a result, he ended up affecting severe burns all around his body, and we found out afterwards that many people have suffered the same types of situations. The first bill that I brought a couple of years ago would have just tried to license the practice. We went back and forth between DPOR and the Board of Medicine and other agencies, all of them not sure exactly what the right agency ought to be. Everybody agreed that there should be some regulation, and yet, because of the nature of laser hair being so, laser treatment is being kind of bifurcated. And so last year, with the advice from many of your members here, we asked the Department of Health Professions and the Department of Professional Occupation Regulations to go back, study this issue, coordinate so that they can come back with one unified statement. You all received this memo back in November. I'm going to pass this out to you if I can. The memo I just sent you, gave you a copy of this from November 23rd. It's a memo to the members of the HWI from the Director of DPOR and the Director of Health Professions, looking at my bill from last year, which of course is House Bill 957, which is, by the way, identical to the bill in front of you today. And there are a couple of points that I just want to point out. The problem statement that both agencies recognize that the existing regulatory scheme for laser hair removal and other minimally invasive cosmetic procedures is complex, and as a result may place the health, safety, and welfare of Virginians at risk. And it goes through and analyzes not only what Virginia does or doesn't do, but also what the other states do. And they found that half of all American states right now mandate some level of physician supervision for laser hair removal, and about a third restrict the use of such technology to only health practitioners. And the FDA also found that there is still continuous warning about serious and life-threatening side effects from laser hair treatments, including blistering, et cetera, and both the procedure itself and the topical anesthetics often used should be performed only under the direction of a medical profession. And so the DPOR and DHP recommends that we codify in our Code of Virginia, on page 4, to provide that the use of laser technology for hair removal be performed under the supervision of person licensed by the Board of Medicine or the Board of Nursing, as well as prescriptive authority and who is responsible for the training, etc. And Mr. Chairman, that's exactly what the bill does, is to follow the recommendations from this report, which was generated from this committee meeting last year. And so I hope that you will consider this and help us close this gap that's already in our regulatory regime right now. I'd be happy to answer any questions. And unfortunately, my constituent couldn't drive down this morning because of the early morning time, but she did send, I think, an email to you as well as pictures from last year, which I don't want to share right now unless you're interested in seeing. Thank you, Mr. Chairman.
Questions from the subcommittee? Mr. Delora.
Delegate Keane, would you be agreeable to on line 124 after the word person?
Mr. Chairman, I'd be agreeable to anything you want to do.
I will hear it, sorry. I appreciate the trust me thought there, but any person who has been properly trained, I'm sorry, probably before person, by any properly trained person. Does that sound better, Sarah? And then on everything will continue that we make clear, because not everybody who has a medical license or osteopathic license has been trained in laser hair removal procedures.
That's a good point. That certainly makes it clear.
Mr. Chairman, I would move that amendment. Second.
Without objection, that amendment is accepted. Further questions from the subcommittee? Is there anyone in the audience wishing to speak to the bill? The subcommittee, the bill is before you. As amended. I move and seconded to report the bill as amended. Is there any further discussion? And hearing none. All in favor, please say aye. Aye. Opposed?
Thank you, Mr. Chairman. Thank you, members.
Delegate Hodges.
Good morning, Mr. Chairman, members of the committee. And before we proceed with House Bill 2454, I have a fairly simple amendment. He's doing that.
Sarah, please.
We have one line amendment on line, page 2, bill line 59. After on-site treatment works, insert permitted for 10,000 gallons per day or less and.
Without objection, the amendment is accepted. Is there another amendment? All right, thank you. Delegate Hodges.
Thank you, Mr. Chairman. The alternative on-site sewage system regulations that were promulgated in 2011, they included an on-site classification designated as direct dispersal to groundwater. Now, the current rule, really, it puts an undue burden on property owners in the coastal plains, which I represent, Matthews County. This eliminates a large portion of the county with AOSS systems. And it puts an undue burden on them in the areas that have the higher groundwater conditions. And it prohibits a standard engineering practice that was really in place from 2008 and 2011. And by creating a technology of prohibitive treatment standards and cost prohibitive maintenance requirements. Now, from 2008 to 2011, the health department has really not identified any specific public health or environmental risk during that time. In fact, the health department is currently writing permits associated with this. And in doing this, and actually, let me back up just for a second. They haven't identified any specific public health or environmental risk. And in this time period from 2008 to 2011, and in fact, they continue to write permits that disperse septic effluent directly into the seasonal groundwater, and actually that's through three processes. upgrades with a statutory transferable waiver, and 3, a non-transferable statutory waiver. Now, a compliance system to meet these standards in this area, it's estimated to be between $45,000 and $60,000 with an operating cost of $2,500 to $4,000. In fact, the health department has recently written there is currently no single technology that can comply with all of the performance requirements for direct dispersal, and to date, no property owner has submitted an application to comply with the requirements for direct dispersal. And since 2011, when these rules were promulgated, no single permit meeting all of the requirements of this rule has been issued by the department, and there have been nearly 40 variances that were approved for repairs and voluntary upgrades. Yet, no variance has been approved for new construction. Now, the Board of Health, they recently approved a fast-track regulation that would ease the burden on existing homes for this variance. But it really did not ease, there's been no relief for new home ownership, or new homes. So what we're trying to do here, ladies and gentlemen, is with House Bill 2454, is have a level playing field for all property owners, whether it's an existing home or new construction. So it's fairly simple. There's a federal standard. We can treat to that federal standard. That federal standard can be discharged directly into a dry ditch or a stream, but yet we're requiring a different standard for direct dispersal into the ground. So we have kids that are playing in ditches. We all did that growing up. We're stomping in it. We're walking in it. You can discharge it directly into a ditch, but yet there's a higher standard for these new property owners. And as amended, this bill would codify the maximum treatment standard for the on-site systems with 10,000 gallons per day or less. So the amendment caps it at 10,000 gallons. So with that, that's the bill before you, and it will be the pleasure of the committee to pass the legislation.
Questions for the paper?
Mr. Chairman.
Del Dora.
And Delegate Hodges, I don't think I have any problems conceptually with what you're trying to do. I guess this is more of a procedure. Because nowhere else that I see do we put such specificity in the code as to what those standards are, which we know probably are going to change and thereby necessitate coming back and tweaking this section. Is there any way we can achieve the same objective with language that doesn't put in the gallons per day, but rather that draws it to whatever the federal standard? Because I understand at the end of it all, that's what you're tying it to.
Yes, sir. If we're looking for a friendly amendment that would tie it to the federal standard for new home ownership with a level playing field, I would consider that completely friendly.
And Mr. Chairman, can I follow up? And Sarah, I see her hastily writing. My thoughts would be something to the effect, the department shall not be more restrictive than, and it would still give the department the latitude if the hydrology was such they felt it could be lesser, and I'm seeing you go with the feds. Okay. All right, so Sarah, do you have some words? Make the magic fix?
I think what we can be doing is adding language that will say the department should not impose standards that are more restrictive than the federal standards. We would want to limit it to a size.
We would want a federal situs, but we wouldn't, in doing that, want to put in the gallons per day and those kind of things, would we?
We have an engineer that actually can speak to that.
Okay.
That's okay, Mr. Chairman.
Mr. Chairman, members of the subcommittee, good morning. My name is Joel Penix. I'm a civil engineer. Got 35 years of experience. I'm on the Sewage Handling Advisory Committee. I'm also on the Engineering Design Review Panel. I've served
type of system. The federal standard applies to systems that discharge into streams and bodies of water. The state alone has the authority and the primacy to regulate the discharges into the soil and into groundwater. Delegate Hodges is correct. There is a fast-track regulatory action to correct the inequity, if you will, as it applies to existing properties. So those are folks who have lived on their land for a long time and have systems that fail and that either need to be repaired or upgraded. There's also a regulatory review action that started with a periodic review that concluded last year in 2016 and will proceed this year with a stakeholder group, and we'll have an opportunity to review these standards during that regulatory action. And so I would hope that the committee would consider that carefully and not undo 5 years of regulatory action that the Board of Health deemed necessary to protect public health. The particular issue here with the systems that discharge into groundwater is that they're typically in close proximity to bodies of water, and in many cases that would be shellfish waters. And so one of our primary concerns in protecting public health and really advancing the state of health in Virginia is to protect those shellfish waters. And it was a very intentional standard that the Board of Health set up for these very limited conditions where the systems discharge directly into groundwater. And I'll close by saying that Virginia, as far as we know, is the only state that by regulation allows septic systems or alternative systems to discharge directly into groundwater. Most of the other states have a requirement for a physical separation between the system drain field and the actual groundwater table.
Mr. Chairman.
Delegate.
So, Mr. Knapp, would it be fair to say from hearing your testimony, one, the department is aware of the situation, the problem, as it were, and secondly, that y'all are some tools in your chest already to try and address it for the existing landowners, but also prospective?
Yes, Mr. Chairman, I would say yes to both of those.
Any further questions from the subcommittee? Anyone in the audience wish to speak to the bill?
Thank you, Mr. Chairman. Again, I support this bill, and I'd like to put it in context for you. On the one hand, the health department is writing permits today that discharge septic effluent right into groundwater. And they do that legally. They do it through repair permits. They do it through a statutory voluntary upgrade. And they do it through a waiver, a non-transferable waiver. And these are all legal, and this is happening in the coastal plain. And I've got documentation where these types of systems are being put in 70 feet away from shellfish waters. On the other hand, we have a standard that is unobtainable. It's unobtainable from a technology standpoint, and it's cost prohibitive from a maintenance standpoint. So the health department created this program, this bifurcated program that said, we're going to create the standard that you can't meet, and if you want to try to meet it, we're going to make it so expensive that you don't want to meet it, and you don't want to put it in. And in 5 years, not a single permit has been requested of the health department for this particular standard. And it impacts, property owners that want to build a home or a business somewhere in the coastal plain. What we're trying to do, what I've been an advocate of for the last 10 years, is bringing this standard, both standards, closer to the middle. I can't do anything about the statutory standards and the septic effluent going into groundwater. That's a
Hodges, last word.
Thank you, Mr. Chairman. And I would say that this is yet another example of overburdensome regulations. And Mr. Penix is correct. If you can discharge directly into that ditch that is feeding right into that creek or that river or into the bay, into shellfish waters, but yet you cannot discharge into the ground, I would say that the ground is another layer of possible protection. So we're really tying the hands of new home ownership and being cost prohibitive to build on these sites where folks have these lands in the rural coastal plain. So I would hope it would be the pleasure of the committee to pass the bill.
Thank you, Delegate Hodges. Delegate Morrow?
Mr. Chairman, was this issue addressed in the past year and a half? There was a very comprehensive study and a very large work group that came out with 20 different recommendations, 8 of which we're going to be hearing something about later this morning. Was this a matter that was taken up for them?
I believe so.
Further, but am I correct? It's not something that was a part of the 20 recommendations coming out of that work group?
It was not.
Thank you.
Subcommittee bills before you.
Mr. Chairman.
Delegate Morrow?
And following up, I guess, on my earlier question just now, there was a very comprehensive study that involved all the stakeholders, and this was not one of their recommendations. And so therefore, I would move under those circumstances, and given that the department is cognizant of the matter and is working on it through the current processes, that we lay on the table.
And if I may, this was non-debatable. This was not taken. And if I may comment to that, if this is something that the department is looking at to correct and take corrective measures, as you said, Mr. Chairman, I would hope it would be the committee should continue to take a look at this to ensure that the department is working on this diligently.
We have a motion and a second to lay on the table. That motion is non-debatable. All those in favor, please say aye. Aye. Opposed? Thank you, Delegate Hodges. Delegate Corey.
Thank you, Mr. Chairman. Good morning, members of the committee. I have 2 bills, and 2109 I would like to go by for the day. And Mr. Chairman, if you're not meeting again, then I do need to call it. We are not able to get stakeholders in agreement enough for me to put that bill forward.
Delegate Corey, at your request, we will take the bill by for the day, which means that it will not be heard. We'll have another meeting.
Thank you. So now I would like to present, with your permission, House Bill 1563.
When you're ready.
Thank you. This bill relates to regulations governing hospitals and facilities that perform abortions. It removes the language that classifies facilities that perform 5 or more first trimester abortions per month as hospitals for the purpose of complying with the regulations establishing minimum standards for hospitals. And sir, there is no fiscal implication. This bill is commonly known as TRAP bill because it is about targeted regulations of abortion providers. And Mr. Chairman, if it's okay with you, if you would agree, I would like to make a couple of supporting statements. Or would you rather have questions from the committee first?
Let me see if there are questions from the subcommittee first. And hearing none. If there's someone in the audience who wants to speak to the bill, I would only ask that you not be redundant. We're We're happy to hear from you.
Good morning. My name is Dr. Serena Floyd, and I'm a board-certified obstetrician gynecologist who practices in Northern Virginia. I'm also the medical director of Planned Parenthood Metropolitan Washington. I have also been an abortion provider for over 10 years and can therefore speak as a medical expert on this topic. I'm speaking to you today to ask you to support House Bill 1563 to repeal the targeted regulation of abortion providers. The Supreme Court in June of 2016 made it very clear that the medical benefit of a law or regulation must outweigh the limit that it places on abortion access. Under the Whole Women's Health v. Hellerstedt precedent, restrictions that require a women's health centers to meet hospital regulatory standards are unconstitutional, as are other restrictions that unduly burden a woman's ability to access abortion without providing attendant medical benefit. Virginia's sham building and construction standards, state-mandated waiting periods, and state-mandated ultrasound requirements are no different. These restrictions are not designed to promote safety, but instead are designed to close clinics that provide abortion services. Closing safe, high-quality healthcare clinics in our communities will not end the need for abortion. What it does is it makes it increasingly difficult and sometimes impossible for a woman who has decided to end her pregnancy to get the safe, quality, constitutionally protected abortion care she needs. What it does is forces women to take matters into their own hands, or forces them into the hands of substandard providers. And what it also does is cut off access to comprehensive reproductive health services, cancer screenings, and primary care for many women in need. Since 2010, Virginia politicians have proposed over 75 restrictions on women's access to abortion and reproductive health care. These proposals are part of a long-term coordinated campaign to end a woman's ability to obtain an abortion and have nothing to do with their health and safety. These restrictions are driven by politicians who are trying to sneak around the Constitution to end abortion by preventing access. The best way to ensure the safety of a woman who has decided to end her pregnancy is to ensure her access to high-quality, safe, legal care. It is to ensure her access to true informed consent, medically accurate information, and services that are appropriate for her unique needs and circumstances, and to empower her in her position, not politicians, to guide her healthcare decisions. Safety is not promoted by forcing women to receive medically inaccurate or unnecessary services. Safety is not promoted by shutting down the reputable healthcare professionals who offer high-quality care. Virginia women and their families deserve to have full access to comprehensive reproductive health care. So please support House Bill 1563. Please ensure that these health care laws are guided by medical evidence and not political agendas. Thank you very much.
Thank you, Doctor.
Good morning. My name is Jill Abbey. I'm the administrator of 4 comprehensive women's clinics across the Commonwealth. Richmond Medical Center for Women and our sister facilities in Charlottesville, Roanoke, and Newport News provide the highest quality reproductive health care, including first trimester abortion, to women in the Commonwealth. I'm here to support House Bill 1563. As administrator, my highest priority is the health and safety of our patients. I have always supported and will continue to support regulations of the medical profession that truly advance patient health and safety, that legitimately promote the highest quality standards of care for medical professionals, and that do not unduly burden a woman's ability to access abortion. The targeted regulation of abortion providers, or TRAP restrictions, enacted in 2011, do not ensure the health and safety of our patients. Instead, they distract from patient care. They harm women by making abortion more difficult, if not impossible, for some to access. They're not legitimately aimed at promoting health care and safety. They are only designed to shut down high-quality women's health care providers. They are trumpeted by politicians, yet they are roundly criticized by physicians and medical experts. The United States Supreme Court has spoken. Laws like TRAP do not stand. I ask you to support House Bill 1563 and repeal the burdensome law. Thank you very much.
Thank you.
Good morning. My name is Emily Prebling, and I am a social worker and a native Virginian. For the past 6 years, I have helped many women access safe abortion care at Falls Church Healthcare Center. The sacred nature of this work for me lies in the safe space our clinic creates for women and their families. It is a space that is boldly and compassionately held by staff who receive bomb threats and withstand obstructions that threaten our work. As a social worker, I am particularly interested in intersecting emotional, physical, and mental well-being of my clients. I believe this comprehensive well-being is largely achieved through evidence-based medicine and mental health care. I also believe from a professional and personal standpoint that safe access to reproductive health care is vital to the citizens of this state. Through my professional role, I have unique insight into the comprehensive services our clinic offers. I am proud to say that Falls Church Health Care Center consistently has less than 1% of a complication rate. We help women access numerous services, including prenatal care, birth control, breast cancer screenings, and annual well-woman exams, while training medical students and staying up to date on current evidence-based best practices. We also provide domestic violence, sexual assault, and counseling resources many of our under-resourced clients would never have otherwise received. In my professional opinion, trap laws do not keep women safe. We keep women safe. We respect them and care for them as if they are our own mothers, daughters, sisters, friends, and partners. Trap laws stigmatize Virginia women and make abortion inaccessible for those without financial resources. We welcome guidelines crafted utilizing evidence-based medical information, not legislation geared towards making our services inaccessible to the women most in need of them. The clients I've worked with are the reason I stand before you today. I urge you not to see them as political statistics, victims, or collateral damages in this debate. They are resilient people with unique journeys and infinite potential who have the right to determine their own destinies. It is time for Virginia to be on the right side of history. Please pass HB 1563.
Good morning, members of the committee. I wasn't planning on speaking this morning and just heard about the committee meeting last night, and I was driven to get up early and come. I'm a retired lawyer. I worked with Dominion. I worked with, I was in the Attorney General's office. I worked for the Department of Environmental Quality, and I worked also in a law firm practicing all different kinds of law. But I just recently retired, and I'm standing here because I want you to see a face of a person who 40-some years ago used Planned Parenthood, and I'm glad that they were there for me. And there are many people in this room who either use Planned Parenthood or know someone who has used Planned Parenthood for a whole range of services. And I want you to know we in our hearts feel very passionately that we want others to have what we were able to have that helped us through maybe some difficult times in our lives or times when we didn't have the money to afford the health care or be able to turn to somebody to help them through what Planned Parenthood was there for us. So I urge you to support this bill. Thank you.
Good morning, ladies and gentlemen of the committee. My name is Leslie Love, and I am a retired school teacher out of Fairfax County at Ellen Glasgow. 45 years ago, I took advantage of what Planned Parenthood had, and over a course of 5 years, wound up having 2 abortions. One of them was a spontaneous, the other one was a doctor-provided. When I was a girl, young women were dying of septic shock from using any and everything they could think of to terminate a pregnancy, including knitting needles, crochet hooks, and coat hangers. I would rather that there not have to be a lot of abortions, but if you provide the services for women and they receive the contraceptive education, then you cut down on the need for abortions. I hope that you will not turn back the clock, because in the 1960s and 1970s, I certainly marched for women's rights. And I find this to be absolutely sad as it can possibly be, that I'm having to come back and start this all over again. I'm 68 years old, and I should not be having to do this yet again. So please, make this harder on women. There was a comment made by a president that said women should be punished. I didn't hear anything in his comments about the men involved should be punished. So please do not punish us anymore. Thank you.
We've heard from that side that we don't have time to allow everyone in the room to speak.
Excuse me, Mr. Chairman. May I ask those who have come to express similar sentiments to simply stand?
Yes, you may.
Thank you.
Sorry. Thank you.
Thank you. Now, that's right.
Is there anyone who wishes to speak to the other side of it?
Mr. Chairman, I'm Victoria Cobb, President of the Family Foundation. According to Code Section 2.2-4006, which is part of the Administrative Process Act, which governs the regulatory process, entities are exempted from regulations when it requires by order of any state or federal court of competent jurisdiction where no agency discretion is involved. According to an advisory memo that went from our Attorney General to the Board of Health, dated on 10/17 of this past year, it says, while the Supreme Court has articulated the legal standard applicable to abortion regulations, I want to emphasize that this board has discretion to determine whether a particular provision is necessary or whether or not it is an undue burden or constitutional. The Attorney General's office stating emphatically that the board had discretion in this matter implies very clearly that the regulations are not necessarily unconstitutional. If the AG believed them to be entirely unconstitutional, then his office should have said so. In fact, the Attorney General's office added in the memo, there's a possibility that the Virginia statutes regulating abortion providers, including the statute requiring certain abortion providers to be regulated by the board as hospitals, could be subject to constitutional challenge. Well, Mr. Chairman, members of the committee, I think we know everything around here could be subject to a constitutional challenge. But that doesn't make it unconstitutional. But I think we need to know that since this, the board has met, considered all of this, and made adaptations to the regulations. But let's talk about the real reason that the abortion industry is so bent on removing state accountability. The hundreds of health and safety violations found in these abortion centers since the standards took effect, including multiple examples of improperly sterilized, bloody medical equipment, violations of state and federal drug laws, physicians and staff who failed to wash hands and re-glove between patients, and far more. So bad that in one case, even this administration had to suspend a facility's license, something that would not and could not have happened without this statute. Mr. Chairman, members of the committee, I close with this. In the past 5 years, the abortion rate in Virginia has dropped over 30%, equaling nearly 15,000 fewer abortions in that time frame. For the abortion industry, that's a loss of $6 million in revenue. And that is the reason they want to remove accountability. I urge you to vote no on this legislation.
Chairman, I would recently about this, we prefer to keep the regulations as they are.
Mr. Chairman, members of the subcommittee, thank you. Bill Wright of the Virginia Catholic Conference. We also oppose this legislation. I'd like to echo the comments made earlier. Also just adding that in our view, abortion isn't healthcare because it ends lives instead of healing them. However, since abortion operates under the guise of healthcare in the Commonwealth, we should ensure that it operates under the safety regulations provided. Thank you.
Kelly Porter, would you like to wrap this up?
Thank you, Mr. Chairman. As you can see, this is a very emotional issue. I simply wanted to make a couple remarks. You are probably aware that Senator Barbara Favola had a similar bill in the Senate, and she was asked a couple of questions that I thought I would volunteer the answers to. some of them are in response to some of the testimony. She was asked if the Board of Health has already acted to amend TRAP, why is a repeal necessary? Largely the answer is because the Board of Health can only do so much and the law still remains the law. We cannot be positive that these onerous regulations that do put women's health clinics out of business won't come back and or be applied in the future. And the other question she was asked is what will happen to the regular inspection of abortion facilities? Abortion providers will go back to being regulated exactly like other physician groups, which is a pretty simple answer that most of us are aware of. So, Mr. Chairman, thank you. Those are my closing remarks. I hope that you will consider the practicality of this measure and vote positively.
Thank you, Delegate Corey. Delegate Ora.
Mr. Chairman, first, just to make folks aware, I've received email testimony from Dr. Imershine, hope I didn't mispronounce it, and a Dr. Ryan that I've shared with the subcommittee members on the matter. I did have one question, if I may.
Delegate Ora.
Delegate Corey, since the initial legislation and the regulations that have been adopted pursuant to that, have any clinics had to close as a result exclusively of those regulations? I'm not aware of any, but if there are some, please let me know.
Delegate Ora, excuse me, that is a very good question, and unfortunately I cannot answer it accurately because frequently, frequently there are multiple causes, but.
Please identify yourself.
Good morning, I'm Gail Dady with the ACLU of Virginia. We know for a fact that at least 2, exclusively because of these regulations. But there obviously have been, we've gone down from 21 clinics to 14, and these trap laws have played a part in the closing of others, but exclusively just for this reason, at least 2.
Okay, thank you.
Mr. Chairman, just before the respondent sends down, so the reason that those 2 clinics in your testimony shut down because of the regulations is because they were not providing enough safety issues care. Regulations basically hold that these clinics need to be held to a level of standard of sterility and infection control and so forth and so on. Is it your testimony that the reason those 2 shut down is because they in fact weren't being held to that standard, and that seems to me that the law may have worked then?
No, that is not why. So the way that this law works is section 32.1-127A, the second sentence of it says that a facility that provides 5 or more abortions per month is to be treated as a type of hospital. That then implicates 32.1-127-001, which requires hospitals to follow certain architectural requirements. Now, the architectural requirements, we refer to them as the FGI guidelines, are things like having to have a certain hallway width, having to have a certain amount of parking spots per square foot for the facility, having to have water fountains in certain areas. Initially, the former Attorney General said that those requirements, which normally only apply to new construction, I mean, just like any building code change, wouldn't apply retroactively. It would apply to buildings that are constructed after the code changes. Otherwise, it would be impossible for any business, any structure, to constantly be in compliance with new changes to the building code. So the previous Attorney General opined that abortion facilities were to be treated differently in this respect, and that they had to comply with the building code even if they were pre-existing structures. So that caused, initially, when it looked like the facilities were going to have to come into compliance with these architectural requirements, it caused those facilities to either have to shut down because they knew that they couldn't, that it was too cost prohibitive for them to comply. And that was the exact issue in the whole Women's Health v. Hellerstedt case. And those architectural requirements, the Supreme Court made crystal clear, have no medical benefit for a procedure like first trimester abortions, which are 99% safe, And they certainly don't have any medical benefit when they are not applied to any other outpatient procedure that is that safe. So basically, if those are required for abortion procedure, and they're not required for things that are outpatient procedures that are more risky, like a colonoscopy or dental surgery or types of plastic surgery, then the Supreme Court called that into question and said, what's the medical benefit of this? They found no medical benefit, and they struck down Texas's law, which is identical to our law. So simply what we're saying is, the reason that those clinics shut down is because of initially the threat that these architectural requirements were going to apply to them retroactively, and they couldn't afford to bring their facilities into compliance. And obviously waivers were granted later on, but that's by regulation. So I think the issue has been a bit confused today. This isn't about the regulations. This is about this statute, and whether this statute, which is quite clearly unconstitutional as written right now, should remain on the books in Virginia and subject Virginia to potential litigation, which would obviously be costly to the taxpayers. So, thank you.
Members of the subcommittee, the question is before you. We have a substitute motion to lay the bill on the table, properly seconded. That is not debatable. All those in favor, please say aye. Aye. Opposed? Bill is laid on the table.
Thank you, Mr. Chairman, members of the subcommittee, and thank you everyone who came from so far.
Delegate Klein.
Thank you, Mr. Chairman. 2264. Mr. Chairman, as we look at our healthcare situation and the rising costs of our citizens into the Commonwealth, we have a duty to allocate available funding in the most efficient manner possible. The best way the state can fulfill its duty to efficiently steward these funds is to ensure that they are distributed to the most effective point-of-service healthcare providers. This legislation ensures that hospitals, federally qualified health clinics, and rural health clinics are funded prior to abortion centers. There are well over 140 federally qualified and rural clinics in Virginia that offer the services that are of top priority. The clinics offer far more comprehensive services, including immunizations, diabetes and glaucoma screenings, cholesterol screenings, pediatric eye, ear, and dental screenings, well-child services, and more. I want to make clear that this bill does not affect Medicaid funding. It simply ensures that the money that our taxpayers send to the Commonwealth is used in the most efficient way possible, directed to health clinics that meet the needs of those populations they serve in the most comprehensive manner possible. So this is identical to the bill that was considered last year. I'm happy to answer any questions.
Questions from the subcommittee?
Dr. Klein, you fill us in on the history of that bill last year.
The bill passed through the House and the Senate and was vetoed by the Governor.
Thank you.
Further questions from the subcommittee? Anyone in the audience wish to speak to the bill?
Mr. Chairman, members of the committee, just very briefly, I would mention you may hear from opponents of this legislation that the President Obama has issued a rule that states cannot restrict funding on abortion. We do know that the new administration plans to reverse that rule, so we still feel it's an appropriate action for this body. Thank you.
Mr. Chairman, members of the subcommittee, Bill Ray with the Virginia Catholic Conference, and we support this legislation. Thank you.
Anyone else wish to speak to the bill?
I'm actually speaking in opposition, so I don't know if you're still looking to hear from people.
That's fine.
Again, I'm Dr. Serena Floyd, and my concern about this bill is that it prohibits the Virginia Department of Health from entering into contracts with or granting program funds to any entities that provide abortion other than in cases of rape, incest, or danger to the life of the woman. Hospitals that provide abortion have been exempted from the bill, which means that only health centers like Planned Parenthood are being targeted for discriminatory treatment. Planned Parenthood health centers offer comprehensive health care services to tens of thousands of Virginians annually, including family planning services, contraceptive counseling, STI testing and treatment, and cancer screenings. Planned Parenthood is one of the few remaining providers that continue to offer consistent and reliable care to Medicaid recipients and often serves as the entry point into the healthcare system for these and other patients. Prohibiting the state from granting program funds to Planned Parenthood means that the full range of comprehensive reproductive health care and family planning services will be unavailable to those individuals, families, and communities that are most medically underserved in the Commonwealth. House Bill 2264 will harm tens of thousands of Virginians, in particular low-income Virginians, who rely on the healthcare services and programs provided by the Planned Parenthood health centers by denying them access to affordable care. The fact is that Virginians, and particularly low-income Virginians, need more access to health care and not less. So I'm asking that you please oppose House Bill 2264. Thank you.
Please make your comments brief. We have a lot of work to do here this morning.
Okay. I'm Amalia Davidson. I live in Henrico, and I'm going to be reading a statement from Dr. Aaron Goldberg. And due to a full clinic schedule of patients today, he's unable to be with you in person, but his main point is that he's repeatedly seen the negative impacts of unintended pregnancy and a lack of access to safe contraception. He asks that you vote against HB 2264 as a vote for the women of Virginia. Thank you.
Thank you.
Hi, my name is Catherine Lawn. I live in Charlottesville, Virginia. I'm a PhD prepared nurse. I've been a nurse for 20 years, and I'm here speaking against HB 2264. Most of my practice has been in service of the most vulnerable women, poor women, and women who've experienced domestic and sexual violence. As you've heard, these clinics provide incredibly important care, filling an important gap for low-income women, and are an essential part of the social safety net for these women. We've seen a decline in abortions in this country, largely because of better use of contraceptives and more highly effective contraceptives. Planned Parenthood clinics provide a disproportionate share of such care to low-income women. We should be working together to increase women's access to this necessary service. I'd also add that Planned Parenthood provides essential screening services. There's nothing, as a nurse, more heart-wrenching than taking care of a young woman diagnosed with advanced cervical cancer, a cancer that's almost entirely preventable with appropriate routine screening. Compassion and common sense suggest that defunding these clinics is terrible policy. We should be providing them more funding, not threatening to cut it. I urge you to vote against this bill.
Hello, good morning. My name is Stacey Vancheri. I'm not a doctor or a nurse or a lawyer. I'm just a person who many years ago, 100 years ago in college, just got sick. I didn't need an abortion. This was not about abortion. I just got sick in college. I had no health insurance. I was away from home. I went to Planned Parenthood, and they took care of me. Simple bladder infection moving into my kidneys. They took care of me. They sent me home with antibiotics. And over the weekend called me 3 times to make sure that I was okay taking my meds and getting better. And I appreciated that care then, and I'd like for my nieces who are on their way to college to have that care now. By the way, the bill was $15 that day. So I'd like for this bill to go through so that people can continue to take advantage of the things that Planned Parenthood does besides abortion, especially people who don't have the resources that a lot of us do have now. Thank you.
Thank you. Briefly, please.
Again, Gail Davey I'm an attorney for the ACLU of Virginia. We oppose this bill, and as stated in the materials that I circulated, federal courts have repeatedly held that a state cannot make an organization ineligible for Title X funding simply because it performs a constitutionally protected activity on its premises. In this case, the Constitution constitutionally protected activity is abortion. And I think no matter how any of us feel about abortion, we can all agree that we have more priorities in this state and with taxpayer money than having to defend protracted litigation that would result from passing a law like this. So I urge you to oppose this bill. Thank you. Very briefly, Mr. Chair, my name is Janice Kraft. I'm the Policy Director for NARAL Pro-Choice Virginia. We do oppose this legislation. We stand in support of Planned Parenthood. I think the majority of this room stands in support of Planned Parenthood, and we thank you for hearing us.
Very briefly, please.
Good morning, Dr. Vanessa Walker-Harris from the Virginia Department of Health, representing the administration's position, and we strongly oppose. Thank you.
Thank you, Mr. Chairman. I'd just reiterate that this is about sending tax dollars to the most comprehensive services available. Over the past year since the legislation was considered last year, I know that one Planned Parenthood clinic in Blacksburg did close because there were more comprehensive services in Blacksburg at the free clinics and other general healthcare clinics available to people in that area. So this simply makes sure that taxpayer dollars go to comprehensive services for women, and hope it would get your support.
Subcommittee members, the bill is before you. Delegate Banner.
I just want to thank everybody for coming today. It's obvious that people are advocates on sides of this issue, and I think everybody has done a good job and been very polite today. So I just want to thank you for coming and being a part of the process.
Bills before us. Moved and properly seconded to report the bill. All those in favor, please say aye. Aye. Opposed? The bill reports.
If I may, before we take it next, just a general announcement. Just let everybody know, matters heard before this subcommittee this morning will be on the full committee docket if they're favorably recommended on Thursday. And also, if there are folks in the audience to be heard on bills on the full committee docket that is scheduled for 9 o'clock, it will probably be closer to 9:30. So if you're waiting just to understand, why don't we get a cup of coffee, that kind of thing, for full committee operations. Thank you.
Delegate Farrell, still with us. Delegate Peace.
Good morning, Mr. Chairman, members of the committee. I believe there's a substitute that council has for the subcommittee.
Delegate Peace, could you tell us about the substitute?
Thanks, Mr. Chairman, members of the committee. I was approached in the session by a number of behavioral health providers who indicated that they had difficulties in being informed about certain regulatory proposals or changes to provider manuals or changes to licensure requirements. And so we sat down with DMAS and PHCS and the private providers, and we were able to come up with a substitute that's before you. In a nutshell, I know you're running out of time, but the behavioral health providers believe that they had not been given the opportunity for sufficient public input in these very important processes that often will negatively impact their business, or certainly impact their business to the extent that it would then require significant changes to how their business would operate. The bill also deals with providing greater public input and input from negatively affected business communities in the DPD process for its economic analysis. That component of the legislation was also included in House Bill 1943, which is the general laws, and was acted on unanimously. Mr. Chairman, I know you're running out of time. I do have some people who would like to speak in favor of the bill. We work with the administration as well as respective agencies on the measure, and I believe with the exception of one technical change regarding the 90-day turnaround window, which is in one of the enactment clauses, the bill represents consensus legislation. There is an impact statement that just was published last night on the introduced legislation, but it's my impression from working with the agencies that the substitute before you does not have a fiscal impact. So I'm sure that you have a letter, but you may not have a letter because the impact statement on the introduced bill was only published last night. I know our night was very efficient, so I wouldn't put it past them. But I would like to invite the folks up who support the legislation as amended to elect her and to address the committee very briefly.
Thank you, Mr. Chairman, members of the subcommittee. I'm Mindy Carlin. I represent the Virginia Association of Community-Based Providers. We strongly support this legislation. Really appreciate the leadership Delegate Peace has shown on this and the willingness of the agencies to work with us to improve notifications and time to comply with regulations once they do change. Thanks so much.
Thank you.
Good morning, Mr. Chairman. Karen Addison on behalf of Caliber, Virginia, also a coalition of community-based behavioral health providers. We're also in support of the bill and appreciate the opportunity to improve communication between the Department of Behavioral Health and Developmental Services and DMAS to improve our compliance with regulations as they come through. Thank you.
Thank you. Questions from the subcommittee?
I have a question. This, if we choose to report this, then it will go to full committee Thursday.
That's correct.
So we would still have an opportunity to get a letter.
Tell your piece and what that does.
I tread very lightly when it comes to letters. I'm happy to comply with whatever the bill may be.
I move the properly seconded to report the bill in anticipation of the letter. All those in favor, please say aye. Aye. Opposed? The bill reports. Thank you. Delegate Farrell.
Mr. Chairman, thank you, sir. I have House Bill 1530.
When you're ready, sir.
Mr. Chairman, I learned this from a constituent, actually, carry this bill on her behalf, that there is apparently a way to do a DNR when you're admitted to a hospital where you can just talk to the doctor and get in your medical record. And I may not be quite correct, but I'm trying to as best as not a doctor to explain it as best I can. But and that has led to some confusion in some instances where in some controversy with family members when they get to the hospital and the doctor, the hospital says this is what they said in the DNR, and it may not, they weren't sure that it would ever track. So what this says is, instead of just orally agreeing with somebody and putting it in your medical record, and apparently this only takes place when you're in a facility, so it's not like you're sitting out and you just call your doctors if you're feeling well, but it's just going to require it to be signed and witnessed, just to make sure that there's a backup, to make sure that the DNR is following the patient's wishes and it wasn't made at the time of being rushed to the hospital at a time of stress. It's just to make sure somebody else saw the conversation and was witness to it and signs it as well. That's what the bill does, Mr. Chairman.
Questions for the people?
Mr. Chairman, Delegate Farrell, can you tell us any other circumstances where a confidential patient communication with your physician currently requires that to be witnessed?
Mr. Chairman, I can't, because I just don't know the answer to that question. If that exists or not, I don't know. I'd have to refer to counsel or some of the hospital or doctor folks behind it.
Mr. Chairman, not a question, just a comment. Delegate Farrell, I understand, I think, but just to relate personal circumstances. 28 years ago, my mother went in the hospital, and as her condition deteriorated, she was still completely lucid. She had a conversation with her physician because she had not executed an advance directive prior to her admission. The family didn't necessarily agree with what Mom wanted to do as it related to life-sustaining measures. But at the end of the day, we honored that our mom
time somebody comes back into the hospital, we've already made a decision on a durable DNR, maybe proverbial shotgun for it.
Understood. Just made sense, so I put it in.
Further questions from the subcommittee? Moved and seconded to lay the bill gently on the table. All those in favor, please say aye. Aye. Opposed?
Mr. Chairman, thank you, sir.
Thank you, Delegate Farrell. Delegate Fullercorn.
Thank you, Mr. Chairman, members of the committee. Before you is a substitute for HB 2258. The clerk, can you please distribute it? Thank you.
Delegate Fullercorn, can I interrupt you just one second?
Yes, Mr. Chairman.
You have another bill on our docket, 2259. Is there, I have a note
Just strike it.
that you wanted to
Yes,
strike
Mr.
that
Chairman.
bill. Let me take care of that.
Thank you
Don't
very
mind.
much, Mr. Chairman.
At the request of the patron, House Bill 2259 is to be stricken. Moved and seconded without objection, that bill is stricken from the docket. Thank you, Delegate Fullercorn. You may proceed.
Thank you, Mr. Chair, members of the committee. Before you is a substitute for HB 2258, and I did have the opportunity to speak with many of you prior to this new substitute. I've only spoken to a couple of you since then. This substitute is very simple. What it's asking DBHDS to do is to report on their activities as it relates to suicide prevention by December 1st of this year. Specifically 37.2-312.1. As many of you all, we've seen a rise in suicides. We've witnessed and experienced a lot of heartache from many of our family members and constituents who have shared personal stories with us. This led me to think that we really should and could be doing so much more. Started focusing on the idea of establishing a task force and realized that actually there was one already in existence, as I mentioned, 37.2.312.1. What I realized is that some of these organizations, interagencies, and individuals that were that should have been part of the task force actually were not fully aware of the task force, and when I realized that they had not yet reported, thought the Section 1 bill made a lot of sense, and that's exactly what this is. So it states, as you can see, that the DBHDS shall report by December 1st of this year, 2017, to the Governor and General Assembly on its activities as it relates to suicide prevention across a lifespan, pursuant to 37.2-312.1. Obviously, as I mentioned earlier, unfortunately, suicides are on the rise here in Virginia. There's a lot that could and should be done, and hopefully the simple bill will enable us to have the information that we need, shine a light on suicide, and move forward as we focus on mental health. I do have an individual who's here, citizen who would like to testify. Her name is Lee Boswell. She's a firefighter and suicide prevention activist. If it's okay with you, Mr. Chairman.
Without objection, the substitute's adopted. Yes, Delegate Fullercorn, let's hear from you.
I'd like to call Lee Boswell, please.
In my family, we like to eat and talk, so I set this little thing. I don't want to take too much of your time. Thank you very much for that introduction, and thank you for everything that you've done to bring this issue of suicide forward. Mr. Chairman, members, my name is Lee Boswell. I just retired from the Fairfax County Fire Department after 27 years of service. And I'm also, as she told you, I'm an advocate for the American Foundation for Suicide Prevention. AFSP is what we call it. It's the leading national suicide prevention organization in the country, dedicated to preventing suicide through research, advocacy, and education. We also like to reach out to those with mental health disorders and those who have suffered loss from suicide. Just to let you know how I got involved in this, I've been involved in firefighter issues down here in Richmond quite a bit, but last year in April, one of my sister firefighters, Nicole Mittendorf, her husband is a state trooper. I'm sure you all saw the story on the news. She died by suicide. She drove herself to Shenandoah National Park, and
and she hung herself by the neck.
No.
In my 27-year career, nothing has ever affected me the way that did. That broke my heart. And I said, in all the work I've done in Richmond and all the work I've done in Capitol Hill on firefighter issues, I've never lifted a finger to do anything to help anyone to prevent suicide. And I said that was going to change, and it has. That's why I stand before you here today. I was proud this year in Fairfax to be the chairman of the Out of the Darkness Walk. Our walk in Fairfax, we raised $150,000. We were the 18th leading walk in the nation. In a nutshell, Mrs. Bulova was thrilled to death because what does this mean? That money comes back to our community. AFSP is an incredible way for communities to offset the cost. We all want to talk about suicide prevention and what needs to happen in our schools with our students, but how do we pay for it? AFSP, if you have, take nothing away from what I say today, AFSP. That is where you can find your money to provide your training for your students. I live in Loudoun County. My daughter goes to Stonebridge High School. 1 month ago, a freshman named Jacob walked into her school, into the gym, tied a volleyball net around his neck and hung himself. This has got to stop. We have got to talk about suicide. Talking saves lives. AFSP offers a lot of training programs. Please, please have your LDs or yourself take a moment, maybe not now, write yourself a note, but visit that website. There are a lot of really effective programs that can be brought into the colleges, into the schools, into your communities. The community-based ones are my personal favorite. There's some programs that are designed specifically for our military. We lose up to, the newest numbers from the VA are 20 a day. That is a staggering statistic. It's heartbreaking to me, and we need to keep this discussion, as uncomfortable as it is, we need to keep it in the forefront.
Ma'am, can I ask you to wrap up?
Sure. That's it. All I wanted to say is I agree with the delegate. It's a simple, straightforward bill. We look to get some information out of the committee. We don't want to be stagnant with this. We want to keep it in the forefront, and we want to continue to talk about it. Thank you.
Mr. Chairman.
Thank you. Delegate Garrett.
Ma'am, we're deeply humbled by your own personal loss, and I sincerely say that. I both sponsored and worked with our local AFSP walk in Lynchburg. It was extraordinarily successful. I appreciate the delegates' advocacy. Mr. Chairman, I would move this bill to be reported.
Moved and seconded that we report the bill. Delegate Orr.
In discussion, ma'am, if you could, to echo, as one who, in my immediate family, we dealt with this tragedy about 5 years ago. And within the family, everybody has after the fact, what could we have done? Is there any way we could have seen this coming? So I commend you with your advocacy. I know Corey, Mr. Chairman, the original bill had certain fiscal implications, and in conversation with Delegate Corey, one of the things she was trying to get as we Delegate Philip Corey, just consulted two delegates profile. But anyway, she was trying to find a way to get information. In our discussions, the department already has this as a charge. We felt the prudent approach forward would be to actually see what information the department can already provide and use that as a platform to supplement and help better facilitate addressing this very critical issue. So I commend the lady for her advocacy. I just want to make that comment before the subcommittee votes.
And Delegate Philip, you know my position on this issue.
Thank you for your leadership as well, Mr. Chairman.
And Mr. Chairman, for full disclosure, on this bill specific, we do have a letter from appropriations, but I believe the substitute would resolve that matter. So while the subcommittee recommendation today, I think is proper that we would recommend reporting, we may need to, if appropriations still wants to look at this, need to have it reported and referred upstairs on Thursday. But this will give you time to get to appropriations with the substitute and hopefully resolve that issue.
Subcommittee, you have the motion before you to report the bill. All those in favor, please please say aye.
Aye.
Opposed? The bill reports.
Thank you very much, Mr. Chairman and members of the committee.
Delegate Lopez.
Morning, Mr. Chairman. Morning, committee. HB 2384, lowering lead action levels in Virginia. The drinking water crisis in Flint, Michigan should be a wake-up call for all of us. According to the EPA's most recent drinking water infrastructure needs survey and assessment, Virginia needs to invest $6.7 billion in our drinking water infrastructure over the next 20 years. That's $335 million each year to fund projects for transmission and distribution, source, treatment, storage, and other related projects. If we want to ensure that a situation like Flint never happens here in Virginia, we need to ensure that we have a regulatory system that allows us to identify potential problems early and address them before they impact the health of Virginians. Currently, if more than 10% of tap water samples exceed the lead action levels of 15 parts per billion, then water systems are required to take additional actions, including taking further steps to optimize their corrosion control treatment, educating the public about lead in drinking water and actions consumers can take to reduce their exposure to lead, replacing the portions of lead service lines, the lines that connect distribution mains to customers, under the water system's control. However, EPA has set the maximum contaminant level goal for lead in drinking water at 0 parts per billion because lead is a toxic metal that can be harmful to human health even at low exposure levels. Lead is persistent and it can bioaccumulate in the body over time. Young children, infants, and fetuses are particularly vulnerable to lead because the physical and behavioral effects of lead occur at lower exposure levels in children. In children, low levels of exposure have been linked to damage to the central and peripheral nervous system, learning disabilities, shorter stature, impaired hearing, and impaired formation and function of blood cells. The CDC recommends that public health actions be initiated when the level of lead in a child's blood is 5 micrograms per deciliter or more. Additionally, the maximum lead contamination level allowed in bottled water by the FDA is 5 parts per billion. Millions of Virginians depend on their public water system for drinking water, cooking, bathing, and mixing baby formula. Why should our tap water have a higher lead action level than bottled water? We should be doing everything we can to make this vital system as resilient as possible. The first step is this bill, which requires that State Board of Health adopts regulations lowering the lead action level from 15 parts per billion to 10 parts per billion by January 1, 2018, and 5 parts per billion by January 1, 2022. According to a recent study of environmental lead exposure in early childhood, children who were exposed to water with lead levels greater than 5 parts per billion had an average increase in blood level levels of 1 microgram per deciliter, or 20% of the level that CDC recommends for taking public health action. According to the Office of Drinking Water, lowering the lead action levels to 10 parts per billion would require Virginia to take action on 35 additional water systems, while lowering the lead action level to 5 parts per billion would require us to take action for an additional 135 water systems. That's 170 water systems in Virginia, where kids are likely to have an increase of 1 microgram per deciliter of lead in the blood due to lead drinking water levels above 5 parts per billion, but under the current 15 parts per billion action level. Mr. Chairman, I think we need to take action now to address this issue and ensure that our kids, mostly in Southwest Virginia and Southside Virginia, where you've got water systems that are not meeting proper standards and breaking the 15 parts per billion standard, they're not irrevocably harmed by our aging drinking water infrastructure. Thank you.
Thank you, Deputy Lopez. Governor Dora.
Mr. Chairman, Mr. Lopez, as I would interpret this bill, you don't feel the Board of Health has been doing due diligence in protecting the water supply of all the citizens of the Commonwealth.
I would say that we could do a lot better, and that currently we have several water systems, according to a recent NRDC study, that say we go way past the 15 parts per billion standard in many communities. The town of Waverly, for instance, is well above 15 parts per billion.
So that's a yes?
Yeah, that's a yes.
Okay. All right.
Further questions from the subcommittee? Baker. Anyone in the audience who wishes to speak to the bill?
Administration, ask the question. Does the administration of the health department have a position on this bill?
Mr. Chairman, members of the subcommittee, Drew Hammond, Virginia Department of Health, Office of Drinking Water. The agency
agency doesn't take a position on legislation, and to my knowledge, the administration hasn't taken a position on this particular piece of legislation today.
Further questions? You all the ones responsible for doing the lead testing?
We are responsible as the primacy agency in Virginia for ensuring that the water systems do the appropriate sampling and then reporting to the Commonwealth, and then we determine compliance with the federal lead and copper rule.
Think our current lead rules are okay?
I guess the bigger question to answer or the response to that would be, currently at this point, the Environmental Protection Agency is considering the role of a health-based standard for their long-term revisions to the lead and copper rule. They just announced on January 13th of this year peer review of draft scientific modeling approaches that will be used to determine whether or not a health-based standard should be incorporated into the revisions to the lead and copper rule. And as a primacy state, the health department has primacy from the federal government, and we implement what is included in the national primary drinking water regulations.
Is that a yes or a no?
I guess let me offer an additional piece of information.
Mr. Chairman, let me phrase the question a little bit differently. Okay. So if the EPA is going to study this, if the EPA says, Virginia, you got to go to 5, you're going to say go to 5, we're going to change the law to go to 5. Per parts permit. If the EPA says 15 is okay, you don't want to change it, in which case we don't need to build. So it strikes me either way, you're effectively saying we're ahead of the ball, we need to wait for the EPA before you guys are going to change your worldview on parts per million of lead in our drinking water.
As the primacy agency in Virginia, in general, the agency adopts regulations that are consistent with the federal requirement. Thank you.
Yeah, Mr. Chairman, just observational. I mean, if we want to start down the road of us codifying what we determine, then I guess we can do away with a number of the state agencies. So we have a regulatory process that sets these standards, hears from all the stakeholders. But if we want to start with lead now, and then we'll just go ahead and plant the trees and kill a bunch of them, because we're going to need more pages in the code book. I understand the patron's intent, but I think this is an overreach, and we've already got an administrative process to address the matter. I'm not declaring anything.
Mr. Chairman, speaking to the
that is non-debatable.
Don't I get a chance to speak?
I'll withdraw my second.
Thank you. Yes,
The fact that the FDA sets the standard at 5 parts per billion, and that we're at 15 parts per billion, and that we have a considerable number of water systems where kids are getting their water, mostly in Southside, Southwest Virginia, in the valley, should raise a lot of eyebrows. And the fact that, the state might not go ahead of the federal government, well, other states have proven that wrong on numerous occasions. Other states constantly move forward and take future-looking positions when it comes to public health and public safety. So I would hope that Virginia would do the same thing, especially when it comes to the insidious effects of lead in drinking water, which we all know to be true. Thank you, Mr. Chairman.
Mr. Chairman?
Go ahead.
I appreciate Delegate Lopez's passion about a lot of things, and we appreciate that. But I think the process exists now, and it'll work its way to get there if we need to get there. So I move we table the bill.
Moved and second to table the bill. Motion is not debatable. All those in favor, please say aye. Aye. Opposed? Bill is laid on the table.
Thank you, Mr. Chairman.
Delegate Lopez. Delegate Warrock.
Mr. Chairman, if I may present from here House Bill 2477, and I do have 3 amendments out of the request on the matter, and Sarah is ready to present those. But in brief introduction, the underlying bill is a result of a study group that was convened this last year relating to on-site septic systems and private wells. The study committee came up with a total of 20 different recommendations, 12 of which are going to require legislative action to implement, but there were 8 of those recommendations that were done within the department's current regulatory process and structure. The bill you have before stakeholder input. It was largely, I'll say unanimous, but it was largely consensus on these matters. And that's the reason for the bill. Sarah has the amendments prepared.
There are 3 line amendments. The first line amendment is on line 12. After steps 2, strike eliminate, and insert begin eliminating. Amendment number 2, line 27. After the 6th, at the beginning of the line, strike separate and insert consider separating. Third line amendment adds a second enactment clause at the end of the bill that reads that the Department of Health shall report on its progress in implementing the provisions of this act and make recommendations for statutory, regulatory, policy, or budgetary changes that may be necessary to implement the provisions of this act to the Secretary of Health and Human Resources and the Chairman of the House Committee on Health, Welfare, and Institutions and Senate Committee on Education and Health by November 1, 2017.
Without objection, the line amendments are adopted.
And Mr. Chairman, members of the subcommittee, with the adoption of those amendments, we kind of tried to slow the train down a bit, shall we say, that if the department is going to be going forward in implementing these recommendations, they're not just going to be able to go out there and force them on the industry. And also, in particular, with the enactment clause, the Department of Health is going to let us know before next year's session how things are progressing, any problems that have arisen, and if we need to make any legislative tweaks to the process next year, we'll have that information hopefully in a timely manner. I welcome. I'm not aware with the current language of any opposition per se, but there are individuals I know that can speak to the matter if there are questions. The subcommittee needs to hear more.
Other questions for the patron? Hearing none. Anyone in the audience wish to speak to this bill? Again, hearing none. The bill is before the subcommittee. I'm sorry, Chuck.
Good morning, Mr. Chairman. Honorable Belly. I'm Trevor Davis. I'm president of the Virginia On-Site Wastewater Recycling Association. We have worked closely with the state health department in developing this entire program.
Thank you. Anyone else wish to speak to the bill? Subcommittee members, the bill is before you. Moved and properly seconded to report. House Bill 2477. All those in favor, please say aye. Aye. Opposed? That bill reports.
Mr. Chairman, we still have on our docket House Bill 2407, Delegate Hugo. I spoke with him last evening. He understands that this is a pretty broad expansion of our current exemptions. I would suggest at this juncture of the process that we let the bill go by for the day, knowing that Subcommittee 3 won't meet. But in the event the questions around this matter are resolved, I would potentially exercise the latitude of the chair that it may come forward Thursday, but absent major change. Because what this does, if you look at the underlying bill, is it's carving out a special exception for martial art programs over the summer period to have kids within their care for 8 hours without any form of licensure. And that is a major policy shift. So I would just procedurally, Mr. Chairman, move the bill go by for the day.
And Delegate Orrock, absent the paper as well. It's been moved and seconded that we take this bill by for the day. Without objection, the bill is by for the day. And I believe our work here is done. Subcommittee 3. Without objection, we stand adjourned.
Mr. Chairman, as soon as we can get set up, we have 2 bills before subcommittee number 1, and we'll get those done expeditiously as soon as we can assemble the members